Hi everyone, welcome to this informational session on respiratory disorders for junior level students enrolled in the fall semester of a medical surgical nursing course. In this session, we will uncover 4 major respiratory disorders, including chronic obstructive pulmonary disease or COPD, pulmonary embolism, pulmonary edema, and pneumothorax. We will touch on the pathophysiology and disease process for each of the specific disorders just to refresh your memory. Our time spent in class together will give you a better understanding of the clinical manifestations, diagnostic findings, medical management, and nursing interventions associated with each disorder. Ultimately, this class is designed to help you identify the presence of common respiratory disorders, as well as anticipate the care needs and treatment measures in which you will use to provide care for your patients. By the end of this class, each student will be able to identify the similarities and differences as it pertains to the care of patients with various respiratory disorders. As you look at this infographic, you will see that I have laid out 4 different major components for discussion. First, we will discuss clinical manifestations. Clinical manifestations can be described as observable signs or symptoms by which a disease may manifest itself to others. You may recall, signs are objective in the sense that they can be felt, heard, or seen. Common examples of objective findings might be that you notice clubbing of the fingernails, wheezing upon auscultation, or the feeling of crepitus under the skin upon palpation. Subjective findings or symptoms, on the other hand, are not outwardly visible to others. Examples of subjective findings might include a patient report of chest pain. The major takeaway here is that you will find that some signs and symptoms are classic identifiers for specific disorders, which will ultimately help to guide your care. A great example of that would be severe anxiety and feelings of impending doom. Though anxiety can be a common finding in patients who are having difficulty breathing, because let's get real here, not being able to breathe has got to be a very scary feeling. But the feeling of impending doom can be a significant finding that would alarm you to consider the possibility of a pulmonary embolism. So how do we go about diagnosing that pulmonary embolism or other various respiratory disorders? We will look into some diagnostic findings. Here we will discuss the information that has been gathered from physical examinations, interviews with patients and family members, past medical or surgical history, laboratory tests, and radiological studies. You might anticipate the need for x-rays, CAT scans, VQ scans, or MRIs. You might also perform pulmonary function tests such as spirometry to measure airflow. Or you may find yourself collecting laboratory studies such as arterial blood gases, complete blood cell counts, or basic metabolic panels, upon other things. During class, we will go into more details about the findings that are common to each respiratory disorder. Next up here in the yellow box is medical management. This can be defined as identified measures that are used to provide symptom relief, reverse causative factors, and treat or manage the disease in order to ensure the best outcome for the patient. Medical management can focus on the acute care needs of the patient, as well as determining more long-term care or management needs. Here you will discover various medical interventions that are specific to each disease. A few examples will be the use of medications to improve respiratory effort, manage pain, or treat underlying causes. An example of treating underlying causes might be the use of anticoagulants for diagnosis of a PE. You will also be learning about different oxygenation methods that may benefit each disease, such as the use of BiPAP or CPAP, and how to hemodynamically monitor your patients. In the last box here, you will see that we will be discussing different nursing interventions. Nursing interventions can be described as the activities performed by the nurse as part of the nursing process. This is where you will carry out doctor's orders. You might also determine nursing diagnoses and create a nursing care plan specific to your patient's care needs. Examples of nursing interventions would be the administration of medications and oxygen as written in the doctor's orders, as well as monitoring your patient for improvements or worsening of symptoms. You might consider keeping the head of the bed at 30 degrees or more to promote ease of respirations, or you might identify the need for dietary restriction. Perhaps your patient has started on an anticoagulant, say Coumadin, for their newly diagnosed PE, since we're on that topic. Because there are foods that are high in vitamin K and they can decrease the effectiveness of Coumadin, it would be important to recognize those foods and beverages that the patient should avoid. This leads us here to one nursing intervention that does not require a doctor's order: patient education. Teach your newly diagnosed patient about the foods that they should avoid and why they should avoid them. This will become an important component during patient interactions, as this will not only affect them in this current moment, but will often be required for long-term management of their disease in order to avoid further complications in the future. To wrap this up, it is important to keep in mind that the course of treatment will differ for each diagnosis. Understanding clinical manifestations, diagnostic findings, medical management, and nursing interventions specific to respiratory disorders will help you to develop the ability to see the big picture. I am confident that this class will give you the necessary insight needed to care for patients experiencing a variety of respiratory disorders. I hope you enjoyed this brief overview of what is to come. I look forward to our time together. Bye for now.